Hi friends, good evening. Hope you all are doing great. I am Dr. Rajesh Babu. So today we are going to discuss one of the major disorder in the neck which is bothering the people who are aged above 60 years. The disease called cervical spondylosis. Cervical spondylosis. So what is cervical spondylosis? Cervical spondylosis is caused due to wear and tear of the ligaments and joints of bones in the neck area. So what are the bones in the neck area? Cervical region. So there are 7 bones or vertebrae. We call them as vertebrae. C1, C2, C3, C4, C5, C6, C7. So as age advances, the cartilages or bones, they are going to degenerate in the neck region. So because of this degeneration, this condition cervical spondylosis develops in the people who are aged 60 years. If you see now, we are seeing this disorder in the people who are aged 40 years. Why? Because due to the occupational health hazards. Okay, we will see the IT professionals who are working on the laptop or computer for such a longer duration. So they keep on working. So that stresses the muscles or bones in the neck. And we also see that people, contractors who often stretches their neck while working outside. So these are the few causes. Coming to other causes, if there is a family history of cervical spondylosis, there is a chance to develop cervical spondylosis. Okay, so if you had any history of injury to the neck, you may develop cervical spondylosis. So what is the pathogenesis in the cervical spondylosis? First, we will discuss about the bone spur. As age advances, in the neck region, we will see that extra bone is forming in the neck. That is called bone spur. So this bone spur is also called osteophytes formation in the vertebrae. So these osteophytes, they will cause pressure on the soft areas like spinal cord, nerves. So once this affects spinal cord and nerves, you feel pain or numbness in your neck. Coming to the other cause, dehydration. Dehydration of the spinal disc. If you see in the cervical regions, so we have vertebrae or spine bones. Between the vertebrae, we have spinal disc. In the spinal disc, there is a gel-like structure which acts as a thin pad-like cushion. This cushion keeps the spine bones together. So once this gel becomes dehydrated, these spine bones rubs together and causes pain. The another cause is herniated disc. Sometimes these spine bones cracks. So once this spine bones cracks, this gel-like structure will come outside and pressure on the spinal cord or spinal nerves. Along with this, we will see that people who are obese, they may also prone to develop this cervical spondylosis. Now we will discuss about the symptoms. So what happens when this spine bones degenerates? What happens when this gel like structure comes outside of the disc? The people start experiencing the pain in the neck region that may extend or radius towards the shoulder blade and to the arm, and in the severe cases that may extend to the fingers also. Okay, it may goes to the right arm or left arm. It depends on the cervical vertebra which is being affected. That is the one of the main symptom in this condition. And the severe cases, the patients experiences numbness. You can experience numbness in the arm or fingers. Sometimes people may experience headache, lack of balance. Sometimes they also develop dizziness. Okay, these are the main symptoms in this cervical spondylosis. Now, when are you going to consult the physicians? If you are experiencing sudden pain or numbness in your arm with electrifying pain, you have to consult your doctor immediately. So how are we going to diagnose this? cervical spondylosis. The physician may ask you to undergo X-ray, MRI, CT scan. Sometimes in the severe cases, you may also required to undergo myelogram and nerve conduction test. So how are we going to prevent this cervical spondylosis? First, you have to maintain proper posture while you are working on laptop or while you are watching a movie or video on mobile phone. You have to maintain proper posture. Okay. Then you have to take a soft pillow which will reduce the stress on the neck muscles. You have to follow proper diet. You have to take lots of vegetables and fruits, and you have to exercise. At least you have to walk for half an hour in the morning or evening. It depends on your time. Okay, and try to reduce the weight. So this is the one of the major cause in developing the cervical spondylosis, where the more weight puts on the neck, and it leads to development of this spondylosis. Coming to the homeopathy treatment in this cervical spondylosis. So in homeopathy, we have wonderful medicines to treat cervical spondylosis, and you may get rid of the surgical condition in severe cases also if it is diagnosed in the early stages. Okay, so we have wonderful medicines like rustox, causticum, calmia latifolia, lacnanthus, paris quadrifolia, and activia spicicata. So we have simsifuga. Simsifuga is the main indicator. So this simsifuga is indicated when you are occupational worker. If you are working as an IT professional or if you are a typewriter, you can take this medicine. So if the pain is starting from the neck and it is radiating to the right side, you can take calmia latifolia in 200 potency. So we have such a wonderful medicine, rustox and causticum. You can take causticum when pain is associated with the numbness. Okay, guys, please take these medicines under homeopathy physician supervision only, because complete cure can be obtained once the proper case taking is done by a homeopathy physician. Okay guys, so this is all for today. So we'll connect again. If you like this video, please like it. If you have any inputs or comments, please share your comments in the comment box, and please do not forget to subscribe our channel. The benefit of this subscription is I'm going to discuss a lot of diseases along with the homeopathy treatment in my upcoming videos. Okay, till then, take care.